is laparoscopy? Laparoscopy is abdominal surgery through a minimally invasive approach. Lap meaning abdomen, oscopy means we look inside the abdomen. So for traditional abdominal surgery, we usually need an incision big enough for us to fit our hands and our instruments inside. If I drew a dog, so this is a dog's abdomen, they're lying on their back, these are back legs. And if I picked any surgery, say the most common surgery in a dog is spaying the dog, ovarian hysterectomy, their uterus kind of sits like this and they have two ovaries. And the traditional approach is making an incision large enough for your hands or your instruments, or you need to pull the uterus up to the incision, and that's a significant size as far as the incision goes. Laparoscopy does the same thing with portal incisions. So we usually need 3, so one here, and one here, or sometimes you'll put them in different parts of the abdomen depending on what type of surgery you're doing. You need 3 portals, 1 for a camera and 2 for instruments, and that's the keyhole surgery through which you can do whatever we need to do in the abdomen, be it removing the ovaries, or removing the uterus, removing a gallbladder, or whatever the other problem is in the abdomen. The benefit to the patient is there's a small incision, so there's less pain, there's faster recovery. The benefit for the surgeon is we have a better visualization. We can see everything magnified in high definition, and we can see if there's bleeding, we can see if there are any problems. We take pictures and show, look, this vessel is appropriately sealed, there's no bleeding, there's much better peace of mind for us. And for certain surgeries, it does make our lives easier too, but it's mostly for the patient. Now, laparoscopy has advanced to something called single incision laparoscopic surgery, or SILS. This was because people don't like having lots of scars around their bikini line. We developed an instrument, and there's a number of them on the market, through which there are 3 holes that fits within your belly button. So people wouldn't have the scars. This instrument would fit into your belly button, and you have a camera and 2 portals. And this is ideal for veterinary surgery, because this portal is the same size as an ovary, it's the same size as a gallbladder, it's the same size as a gastropexy, it's the same size as most of the things we do in the canine and often the feline abdomen. With traditional laparoscopy, we would have to extend one of the incisions so that we could take the ovary through and remove it from the abdomen. But with the SILS, we're able to eliminate these. So we can do laparoscopic spays through one small incision that is the same size as an ovary. The other thing we often do concurrently with this is if we're doing a gastropexy, if the stomach sits here, and we want to, if the gastropexy is creating an adhesion between the stomach and the body wall to stop the stomach twisting and bloating, we are able to put our incision there, remove both ovaries, so spay the animal, and do the gastropexy all at the same time through one incision. And then this patient has less pain, recovers faster, and in general has a much better experience with a surgery that's necessary for them when they're young. Thank you for watching our video. The content is for informational purposes only and should not be used to diagnose a condition in your animal. As always, it's very important that your pet's examined by a veterinarian should you be considering these procedures. I would recommend having a seen either here or by your local veterinarian before considering any treatments.